In anesthesia, protecting the patient's airway is our top priority. A difficult airway means a trained anesthesiologist struggles with ventilation or intubation. Failure to secure an airway can cause brain injury or death within minutes. Recognizing and preparing for a difficult airway is essential for every anesthesia resident. The Difficult Airway Algorithm is your mental roadmap in a crisis. It provides a structured, stepwise approach to prevent panic and guide safe decisions. Mastery of this algorithm defines your competence and ensures patient safety. Every patient under anesthesia trusts us with their life. A failed airway is one of the most feared events in our field. The knowledge and practice of the algorithm turn potential disasters into manageable problems. Your goal is to make the algorithm instinctive, so you always know the next step. This preparedness separates novices from experts. Mastering the difficult airway is a journey. Moving from theory to confident action, patient safety depends on your readiness. Managing a difficult airway starts with thorough preparation. Always assume any airway could be difficult. Check all equipment, laryngoscopes, blades, endotracheal tubes, stylets, bougies, and ensure the difficult airway cart is ready. Prepare your team. Airway management is a team effort. Communicate your plan and backup options before induction. Use mnemonics like Lemon to assess for predictors of difficulty. Look externally. Evaluate mouth opening. Check Malampati score and neck mobility. No single sign is perfect, but combinations raise suspicion. Optimize patient positioning and pre-oxygenate before induction. The first laryngoscopy attempt should be your best. Use the right technique and tools. Confirm tube placement with end-tidal CO2. If intubation is easy, proceed as normal. If you encounter difficulty, the algorithm guides your next steps. Preparation and assessment are your best defenses. Anticipate problems before they arise. If intubation fails, ask, "Can I ventilate the patient?" If yes, you have time, pause, call for help, and plan your next move. Oxygenation is always the priority. Don't fixate on the tube. Consider changing technique, blade, or using advanced devices like video laryngoscopes or fiber optic scopes. Don't repeat failed actions. Adapt your approach. If you cannot ventilate after failed intubation, you face a can't intubate, can't oxygenate (CICO) emergency. Call for help immediately and attempt a supraglottic airway, like an LMA. LMAs can quickly restore ventilation and buy time. The algorithm's decision points keep you focused and prevent fixation. After each attempt, reassess. Can you ventilate? If yes, consider alternative intubation strategies. If no, restore ventilation by any means. Two-person mask, oral nasal airways, or LMA. The algorithm is a dynamic cycle act, assess and react to keep the patient safe. Always prioritize oxygenation. When basic maneuvers fail, but you can ventilate, use advanced tools. Video laryngoscopes and fiber optic bronchoscopes are essential for difficult airways. These devices provide better visualization and navigation, even in challenging anatomy. Supraglottic airways, like LMAs, are not just rescue devices. They can be primary plans or bridges to intubation. Some LMAs allow intubation through them, especially with fiber optic guidance. Quick, correct SGA placement is a core skill. If you cannot ventilate or intubate, proceed to a surgical airway. This is the final safety net. Emergency front-of-neck access, FONA, usually cricothyrotomy, must be performed without hesitation. Regular training and mental rehearsal are vital for this rare but critical event. The decision to perform a surgical airway is difficult, but necessary when all else fails. It's not a failure, it's a life-saving step. The goal is always to get oxygen into the lungs. Knowing when and how to act marks you as a responsible anesthesiologist. Technical skill is only half the battle. Managing stress and teamwork is just as important. In a crisis, control your breathing and state your plan out loud to keep yourself and your team focused. Panic is the enemy. Clear communication is your ally. Call for help early and assign clear roles to your team. Use closed-loop communication to avoid errors. Practice and simulation are essential. Drills build muscle memory and confidence. Regularly rehearse the algorithm, advanced devices, and emergency procedures. Simulation prepares you for real crises, making your actions automatic. Readiness is a mindset. Expect the unexpected and trust your training. Mastery comes from practice, teamwork, and preparation. Embrace every learning opportunity and simulation. Your competence ensures patient safety no matter the challenge. Be ready, your patients depend on it. Subscribe for more such informative videos.